it's short of amazing, all the projects you've put out. I don't know where you find the time. But could you tell us more about your recent ones, the most important ones, and where can we learn more about them?
So I'm really right now most passionate about training practitioners in this approach that we're talking about, because I realized a few years ago, you know, there's a limit to the number of patients that I can help as an individual clinician. And even training other clinicians in a kind of one-on-one apprentice style, there's a limit to the number of people that I can train that way in my lifetime. But if I can train hundreds or even thousands of practitioners a year, and they then see maybe 10,000 patients over the course of their career, then I can have an exponential impact, and we can help that many more people. So I have a program called the ADAPT Framework Practitioner Training Program that's been going for a couple years, and that's mostly for licensed healthcare providers like MDs or nurse practitioners or physician assistants, or people who are working in that type of environment. And then next year, I'm really excited about launching a health coach training program, because I've come to realize that the biggest cause of the chronic disease epidemic is environmental, not genetic. So it's diet, lifestyle, physical activity, sleep, stress management. And let's face it, doctors are not the best people to be working with patients or clients on those things. You know, if even a functional medicine provider like myself, if I have a half-hour appointment with somebody and I'm doing, you know, testing their gut and their HPA axis and their blood chemistry and a bunch of other things, and I get all those results back, it's going to take most of the appointment to go through all those results and prescribe a treatment protocol. And I might have very little time at the end of that appointment to actually talk to them about their diet or their sleep and the things that we know are really hugely important to their health. So this is where health coaches can make an enormous impact, because they are ideally suited to do that kind of work with people, and they're trained in behavior change and coaching psychology. They understand the obstacles to making these kinds of changes that people face, and they're trained in how to work with those obstacles. And the reality is we can quickly train a lot more health coaches in a short period of time to be able to work with people than we can new doctors. We already have a shortage of primary care providers, and that's only predicted to get worse in the next 10 or 20 years. So I firmly believe that health coaches are going to be a big part of this solution, and that we absolutely need them. But that the currently available trainings many of them are great and have a lot of positive aspects to them, but I really want to train people in this framework that we've been talking about so far.
Yeah, I've gone through the ADAPT program, and I have to say it's really good. It's amazing. It's so well structured, and you get everything you need for your practice. So I would advise every functional medicine practitioner to take it. It's really worth it.